My name is David Wright. I'm Director of the UK Safe Internet Centre at the UK charity SWGFL. The UK Safe Internet Centre is one of 32 European Safe Internet Centres. Together we make the European InSafe network. We all pretty much do the same thing in terms of responsibility for managing illegal child sexual abuse material online, as well as operating helplines and awareness raising. You know, the greatest example of that is Safe Internet Day, which next year will be on the 9th of February. Do you know, it's been our pleasure and our privilege to have worked extensively with Ukraine over the last couple of years, really on behalf of the United Nations ITU around child online protection. So we engage with a number of various different ministries, together with stakeholders, including industry providers, NGOs, and obviously children and parents as well. It was a really fascinating experience, and I say, seeing the impact, and this very event is testimony to that. And you know, I so applaud particularly Anastasia and Gulsana in their work and driving this forward for the protection of children. It's been an extraordinary few months, hasn't it, globally? And that was what I wanted to talk about here, to highlight, looking at the impact that COVID-19 and the restrictions, the global restrictions that we've seen, have had on children. Over the last year, we've been involved, and I've led on behalf of the ITU the revisions of the ITU's Child Online Protection Guidelines, and so there's 4 versions of these: one for parents and for educators, one for children, one for industry, and the one that I led was the ones for policymakers. Now, to coincide with the release of this in June earlier this year, we actually compiled information looking at the impact that the COVID-19 restrictions have had on children across the world. And published an article, corresponding article, that really just highlights that. But if we think back to last March, what we referred to as this digital migration, when restrictions were starting to be imposed worldwide, we all, nearly all, turned to the internet to maintain some form of normality in terms of communication, of contact, socialising, as well as consumption, entertainment, and obviously from a child's perspective as well, their learning. And some of the numbers associated with this are extraordinary. So from a UK perspective, BT, the infrastructure provider, the primary infrastructure provider, reported increases of between 35 and 60% of internet traffic within the day. In the US, Verizon reported something very, very similar, 22% increase in their web traffic, almost overnight, as we all made this digital migration. In terms of the sorts of content the services that we're accessing, there was a massive demand for all sorts of different content. In Australia, the primary news services all reported increase, 57% increase in demand for news across Australia. Streaming services, particularly video streaming services, the likes of Netflix and Disney Plus, all kind of grew hugely over that period. Across Europe, Netflix, for example, to quadrupled the capacity that they have in order to deliver their content. Disney Plus entered into the fray. It was actually launched in the end of 2019 and just exploded, fueled in large part because of people's appetite and demand for video-based content. All sorts of other content as well there was demand for. So, for example, MindGeek and Pornhub, so pornography content, they reported a rise of about 23-24% spike in additional content that they were delivering. Zoom, as you know, in terms of video conferencing, Zoom in December 2019 had 10 million subscribers, or 10 million users, and by March 2020 they had 200 million users and kind of registered accounts. So huge growth in terms of, like I say, extraordinary numbers that articulate this digital migration that we refer to. In April, we saw a number of organisations issue warnings and predictions about the impact that this might have on children. UNICEF highlighted that 1.5 billion children across the world were being affected by school closures. That's a lot of children. The wpratech's Global Alliance, as well as Europol, both highlighted the impact that this may well have. The fact that children will be more at home, parents perhaps are trying to work at home and so have less time and less attention to give to children. So children will be left to, as we put it, their own devices. And so left alone without any particular supervision, clearly highlighting some of these particular risks. But you know what we were most interested in is what the impact's actually been. What's the evidence and the research that we've seen that's led to this particular as caused by the restrictions and that impact on children. So we did see, from a child sex abuse material, we have seen evidence around an increase in demand. Perhaps this is fueled again by people having more time on their hands. So we saw in America, we saw in India, and we saw in Spain, the national reporting centres all reporting an increase in reports of child sex abuse material online. In the UK, the IWF, the Internet Watch Foundation, reported in May, together with their partners, blocking access to 8.8 million attempts to access known child sex abuse material online. And this trend is continuing as well. IWF, September was their busiest month in terms of the agency being, from a UK perspective, responsible for receiving reports, for searching for child sex abuse material online with a view to getting it taken down. September was being the biggest month, the busiest month they've had in their history. Again, this is all evidence around increased access and increased demand. We've also, again, UK, in terms of impact on children, the National Crime Agency in the UK highlighted there was estimated that there was some 300,000 individuals that posed a threat to children online through either some form of seeking out child sex abuse materials or indeed children themselves. Clearly massive figures and particularly worrying. We were also really interested, though, what's been the impact on children's mental health and mental well-being. Now, this data is much more UK specific, but we've seen a number of reports published that start to highlight this. So the UK agency Young Minds did a survey of some 2,500 children who had previously accessed mental health services in the UK, and they concluded that, amongst a number of things, 32% of those children felt that the pandemic and the restrictions made their situation, they felt their situation was making it much worse. I quote. Girl Guiding Association, as well as the Duke of Edinburgh's award, both looked at the impact of being online more. Particularly the Girl Guiding survey looked at 6,500 15 to 18-year-olds, and unsurprisingly concluded that 83% felt that they were spending more time online. But in terms of its impact, they concluded that 26% of this age group felt pressure to conform more to online stereotypes, so body image and that type of thing, so weight loss, that was what they felt a pressure to conform to. 20% of them, 1 in 5, also felt the pressure to be online all the time. And that's a really important thing, I think, just to kind of highlight. This is one of the things we've talked about for a number of years, this pressure to be online. We often ask children, well, how many hours a day do you spend online? Well, almost hardly any, particularly children, will actually ever turn their device off, their smartphone or any particular device. If you don't turn the device off, you don't go online. We are online. And so it's much more, I think, about the questions about, well, what do we do online? What particular activities are we doing online? So rather than necessarily how many hours a day are we online? because of that very reason. Like I say, we don't go online, we are online. And so 20% of children, 15 to 18-year-old girls, feeling this pressure to be online all the time. This expectation that when you send a message, you get a response instantaneously or almost. And so there's that compulsion to respond. And this drives perhaps what we might suggest is perhaps an unhealthy pressure alongside this. As we go forwards, we'll disclose more and more. We'll discover more and more impacts as research is conducted across all sorts of different impacts on children, and that's one of the things that we'll continue to update and to keep a particular eye on. So. That was the one thing I wanted to highlight to you, and you'll find all that information, indeed more, in the article that we posted online and will be provided to you as well. So you can go and find out perhaps a little bit more about this, and would very much welcome any particular comments or points or questions that anyone has. So if you can drop me or drop the team a line at esafety@swgfl.org.uk. That's esafety@swgfl.org.uk. Of course, we'll be able to respond to any particular questions, points, or indeed queries that you may have. Again, I would like to congratulate particularly Anastasia and Gulsana on such an amazing day, and the progress that's been achieved. We saw this at the event in December last year that we came to and helped co-present, and it's great to see progress that's been achieved. That hopefully it's played its part in stimulating and provoking and indeed encouraging that progress. My congratulations. Thank you very much. Have a great rest of the day.